Instead of saying it's a clock, they may say that the round thing with the hand or something like that. They may question or ask questions over and over again. They may have problems sort of remembering to pay bills or paying their bills or following a recipe, something like that. Alzheimer's disease is tough. I'm not going to lie, as somebody who has and has had family members with Alzheimer's, who has been a caretaker, who have family members who are caretakers, I know firsthand, and also from being a doctor, I know firsthand how tough it is, not only for patients with Alzheimer's, but for family members and caretakers of people with our loved ones with Alzheimer's. What are these sort of signs and symptoms? There are 10 of them that the Alzheimer's Association gives. Well, the first is memory loss that disrupts your life, okay? Person with Alzheimer's has memory loss that is not just memory loss, but it disrupts their ability to live and sort of function, meaning they need to rely on notes or other family members or things like that to remember things. They may question or ask questions over and over again. Another issue is number two is problems with planning and problem solving. So they may have problems sort of remembering to pay bills or paying their bills or following a recipe, something like that. Keeping track of things and keeping concentration. Number three is there can often be problems with completing familiar tasks, things that these folks are used to. Maybe driving to a location that they've always driven to, they may have trouble driving to that location, something that's familiar to them. You should understand that Alzheimer's disease is the most common cause of dementia, okay? Most common cause of dementia in older adults. Dementia basically is a group of signs and symptoms that are associated with a decrease in memory, problems with reasoning and thinking, etc. And again, Alzheimer's is the most common cause of dementia in older adults. Alzheimer's basically is caused by changes in the brain that then leads to these behavioral and thinking changes that we notice in our loved ones, our family and friends. So number four is confusion regarding time and place. So they may lose track of the season, lose track of the day of the week, the month, etc. Sort of be lost with regards to time and place. Number five is problems with spatial sort of orientation at times, problems with visual images, spatial relationships. So this may play out in problems with driving or even keeping balance or judging distance, right? So there's a spatial sort of disconnect with some patients with Alzheimer's. Number six is new problems with words when speaking or writing. So they may struggle with naming things, or they may call things the wrong name, okay? Instead of saying it's a clock, they may say that the round thing with the hand or something like that. So trouble naming things, trouble sort of recalling the names of things as well. Number seven is losing things, but you can't retrace your steps. Not just losing things, because we all sort of lose or misplace things from time to time, but you lose something and you can't kind of retrace and remember, kind of backtrack, that type of a thing. Number eight is decreased or poor judgment, not making good decisions, not having the ability to make good decisions. Number nine is withdrawing, okay? Withdrawing socially from work, from home, from social experiences and things like that. Folks with Alzheimer's may have trouble keeping, holding conversations, comprehending, following, concentrating, and things like that. So withdrawal may be something that we see. And then number 10 includes changes in personality or mood. So whereas your loved one normally was or has been a certain way, they may have different changes in personality or mood changes. They may become fearful or angry or anxious or lash out or suspicious, or their mood or personality may change. This list is not all encompassing. This is just sort of, I think, a really good sort of general descriptor of many of the things that can happen with Alzheimer's disease. Again, this is according to the Alzheimer's Association. I really liked this description. They have a great website, by the way. This is not an ad or an endorsement. It's just, I think it's a great resource to learn more. There are many other great resources out there as well to learn about Alzheimer's. But the thing is, I think is most common, or rather is most important, is that if you have concerns about yourself or concerns about someone else, a loved one, you really need to talk to your doctor or their doctor, okay? Of course, with their permission and with them. This is really, really important. There are evaluations that we can do, physical exam, certain testing. There's things that we can do to explore and understand better what may be going on. So don't ignore signs and symptoms that you have concerns about. I've always said this, and it really applies here as well. Let me know what your experiences with Alzheimer's disease have been. Once again, I shared that I've had family members and do have family members with Alzheimer's. I've helped take care of family members with Alzheimer's and do know it can be really, really tough. Tough for everyone, the patient with Alzheimer's and those who care for them and love them as well. So let me know what your thoughts are. I'm Dr. Jen Caudle, a practicing family physician. If you've not liked and followed my page, I invite you to do so. I do daily videos on all sorts of stuff. You all know this. Also, consider joining my subscription group called Dr. Jen Superstars. That's for exclusive content. For those of you who watch me on YouTube, hello. Please subscribe to my channel and click the little bell for updates. And guys, I'll be back soon.